Good afternoon, everyone. This is What's Happening, and I am Connie Ryan, Executive Director of Interfaith Alliance of Iowa. What's Happening is our mostly weekly online forum where we talk with a variety of different experts and guests from around the state on just a whole spectrum of issues. We haven't had a What's Happening for several weeks now because we've been a little busy with a couple of other big projects. But we are glad to be back, and I am glad to be back because I really, truly enjoy having these conversations with people who are so knowledgeable and so invested in the work that they do that really impacts Iowans. And I am delighted to be back. If you have questions as we go along in the conversations, if you have questions, you can put those in the comment section, and hopefully we'll have time to get to those. But to get going, as you know, our country really is wrestling with reproductive health care and what the rights are of people, and making sure that we continue to protect people's rights. And we have challenges in states across the country. We have challenges at the federal level, and certainly we have challenges in Iowa. And so I am really glad to have my dear friend, Burch Elliott from Planned Parenthood, with us today to break all of that down and to talk about all of those pieces that really are impacting people's ability to have access to reproductive health care. Welcome, Jamie.
Hi, Connie. I'm so glad to be here with you today.
I am so glad that you are taking the time. I know you're super busy right now, and thank you for taking the time to be with us.
Of course. I'll take a second to just say hello to everyone. I'm Burch Elliott. I'm the Director of Public Affairs for Planned Parenthood Advocates of Iowa and Planned Parenthood North Central States. So I oversee the political work that Planned Parenthood does in the state of Iowa. And I'm joining you from my newly moved in home office. So forgive me for the echo and for any other background noise you may hear. We've got folks here, making some changes and updates to our new home. So I just moved. And so if there's any weird background noise, if you're wondering why I have empty bookcases behind me, it's because I haven't unpacked the books yet. So, so forgive me, but I'm glad to join you here today.
We have all learned in this new era of doing a lot of this work online that you just take it as it goes. It is all good, and we're excited for you and being in your new home. So you've talked a little bit about who you are and your job, but I am interested in how you got into reproductive health care. And I would add a little piece of why is it so important to you?
Yeah, from a personal level, I got into reproductive health care when, I grew up in a rural community, and there wasn't access to reproductive health care. I went to my family doctor that I'd been going to since I was a child, and the same doctor that treated my strep throat and my ear infections and everything was the same doctor that I went to for my birth control when I was a teenager. And so it was just, an uncomfortable experience. And you always, in a small town, there are HIPAA laws, of course, but you don't know how far those go, right? You're in the same community with the doctors and the nurses. And it would, and it's not that my doctor wasn't qualified or couldn't provide that health care. It was just that if I could have gone somewhere else, or if I could have seen a different provider, I would have. And so, from a young age, I started to notice the differences in in access to healthcare and to reproductive healthcare. And then, of course, as you unpack issues as you're growing up in a rural community, I started to understand reproductive rights and health. And, from a young age, my way to solve it was to get involved in politics. And so that's what I did as a young woman in Austin, Iowa, and Winneshiek County. So personally, that's kind of how it started. Of course, working at Planned Parenthood, doing the work that I do is a dream job for me, and I'm so grateful to be here. But it's, that's how I got here. It wasn't a clear path. But from a young age, I started to kind of understand that access to healthcare wasn't the same for everybody and for every body, right? So that's what got me here. What was the second half of this question, Connie?
I think you really kind of covered it. Just
okay.
Why it's so important to you. So I think it's you're good. So talk a little bit about. I want to go back to kind of some basics. I don't want to jump right into the politics of all of this, but for you, why is, I assume that reproductive health care is a civil right, a human right for you, and so why is that? Just the basics of why is access to reproductive health care a basic civil right, human right, and talk a little bit about that social justice movement that has happened for decades and decades, but certainly has come to a head currently.
Yeah, the fight for reproductive justice in particular has been around, longer than the traditional movement that you would think about, right? The Gloria Steinems of the United States here, and what we see in advocacy for sexual and reproductive health care. Reproductive freedom is actually, and reproductive justice is rooted in the civil rights movement, and was and continues to be run by Black women. And so reproductive justice is a concept that should not be, so controversial, but it's just the concept that no matter where you live, no matter your income level, no matter what resources you have access to, you should be able to decide if you want to start a family, how many children you have, how those children, how much time comes in between or falls in between each of those children, where you access your health care once you are pregnant, or if you don't want to be pregnant, the ability to access birth control and other sexual and reproductive health care, access abortion. And so, it's a movement led by Black women and has largely been left out of the bigger conversation around reproductive health care and reproductive freedom. And right now, we are in a point in time where it's, I'm kind of going off on a tangent here, but we are at a moment where it's very clear that we as white women leading the movement, whether it was intentional or not, have left women of color out of the picture and have left, LGBTQ rights activists out of the picture when it comes to fighting for abortion rights, but fighting for reproductive health care in general. And so now we're in a time in the movement where we're recognizing that. I mean, we've recognized it for a while, but now is the time for us as white folks to let the people of color in the movement lead. You'll see that the current Women's March, for example, at the national level is led by all women of color. And all of the organizations partnering on that are led by women of color. And so it's, the reproductive freedom and reproductive adjustment or reproductive justice, again, to recap, comes from the civil rights movement, right? It's that sense that everybody should have the freedom to make their own reproductive health care decisions. And this is, it goes from birth control or STI testing and treatment to all the way up to, if you want to have kids, you should decide and you should be able to provide for those children, right? It's and what we see here is that abortion rights don't exist in a vacuum. Abortion rights are intertwined with immigrant rights, with workers' rights, with with civil rights in general. And so it makes sense now that we advocate for all of those things at the same time. And because it is impossible actually to peel them away from each other. And it serves no one to keep all of those issues in a silo. I think what we're witnessing in this moment in time is that the true leaders of those movements are leading those movements. And we as good allies and accomplices we step aside when we recognize that it's our time to do so.
Yeah, and that's part of the beauty in my life is that I get to work with you on so many issues, as well as so many of our colleagues on that intersectionality of so many of the issues that you and I both work on, as well as a number of other people. You mentioned the LGBTQ community, and so I want to break down a little bit for folks. Especially in terms of abortion, oftentimes people will say women's access to abortion or women's reproductive rights, and you are very careful to be inclusive and to talk in terms of who needs to have access to reproductive freedoms and reproductive health care. And that is specifically to be inclusive of the LGBTQ community. So talk a little bit about that, what that is and why that's so important.
Yeah. Speaking about abortion, I'll start with abortion. Speaking about abortion specifically, not all people that seek abortion care identify as women. Right. So we know that gender is a social construct, right? So it's something that our society has assigned a label and kind of given life, right? It's something that we've created, and it seems like it's black and white gender, and it's not. And so, there are people in this world who identify as a man, but have a uterus, right? And a uterus comes with some maintenance, right? There's period management, there's birth control, and there's abortion. So there are folks in this world that identify as a man, but seek abortion care. And it's important to include them by using language that is inclusive. And it's important to include the LGBTQ community in language that allows when we're discussing abortion, right? And so while it might just feel right to say women's rights, we're leaving out a whole group of folks, both folks that identify as male or gender nonconforming, and et cetera. So, it's also part of LGBTQ rights and health are also part of sexual and reproductive health care, right? So gender affirming healthcare, meaning seeking healthcare that aligns with your gender identity. And sometimes there's specific healthcare that helps folks manage our there is healthcare that helps the LGBTQ community, such as hormone therapy, right? And so Planned Parenthood has provided gender affirming hormone therapy for a while. Long before it was the cool thing to do. You might see hospital systems providing this healthcare now and promoting it and making it a big deal. And it is, right? It's frankly sad that it took this long for mainstream healthcare providers to get to this point. But, it's important to sum up here. I kind of just went down a rabbit hole, but to sum up here, it's important to recognize that not all people seeking abortion care identify as women. And it also is worth noting that not all women have reproductive organs that you would normally think about a woman having, right? So on the other hand, there might be folks that identify as women who don't have uteruses, and so, or other, reproductive organs that, that you would think about with women. So it's really important to use inclusive language, and I know it can be confusing sometimes, and I know it can be hard, but these things are a practice, right? Like being a good citizen. If it were easy, everybody would do it, right? We wouldn't like be where we are today. If everybody just took a little time to think about the language they're using and why we use that language and why we're including so many other people in one movement, right? Sometimes you might think, well, that means that organization is straying away from their mission. And it's not, right? It's this allyship and this accomplishship. I think I made up that word, but it's part of being a good partner and part of showing other movements that their movement is your movement and your movement, and vice versa, right? You are fighting this fight alongside them, not for them, not in place of them, but alongside them.
Yeah, all of that is so critically important. And I would add that if you aren't sure, or if you, not about somebody else's sexuality, but about the issues, the broad issues, if you aren't sure, educate yourself. Listen to shows like this and do some reading, and know that you will mess up, and apologize when you do, and learn some more, and find people who can help you learn. So let's turn to politics then, because all of this is stuck in the middle of politics. And there's been a lot happening. I want to set Iowa aside for now. We'll get to that. There's been a lot of things happening, particularly at the federal level, and a big case that just came out last week, 2 weeks ago. I don't remember, time flies. And then another case that is in the pipeline, Texas case and a Mississippi case. So talk to us about those and what's happening.
Woo! So there's a lot to cover. Buckle up.
Maybe be briefer on this part, and we'll get to Iowa. So we make sure we get
yeah.
I
actually want to step back one more step and just call out how we got to this position, right? You may recall, and I know this audience was involved in a lot of the fights during when the Trump administration was changing the federal courts, right? We were protesting, we were letter writing, we were doing all of the things to try to prevent Supreme Court justices, or try to prevent our United States senators from supporting particular Supreme Court justices, right? So Justice Kavanaugh, Justice Coney Barrett, for example, two in particular where repro rights advocates were saying, like, if these people are on the court, abortion will become illegal. And, I will never forget, Twitter and talking heads on news story or on the news saying that, when we were mourning the death of RBG, saying, well, they'll never overturn Roe versus Wade. We are in the moment that we were warning you about. We are in the moment that we were afraid would happen, and it's here now. And so that moment includes two really key Supreme Court cases, or key laws, right? Like Connie said, in Mississippi, you have a 15-week ban. This case is called Dobbs v. versus Jackson Women's Health. Jackson Women's Health being the only abortion provider in the state of Mississippi, a clinic that has faced a lot of challenges just to stay open. And so what's interesting about this case is that typically these cases don't even get to the Supreme Court. The Supreme Court justices look at the law and they say, you know what? This is decided in Roe versus Wade. Send it back down to the lower courts. Their decision stands. We're moving on. The difference here is that the United States Supreme Court has decided to hear this case. And that in and of itself tells you that the law probably won't be the same when the Supreme Court's done with it. What could happen there? There are three, this isn't very large overgeneralization, but there are three, I'd say, anticipated outcomes. One, Roe versus Wade is overturned. And folks keep saying that'll never happen. And it can, it really can. I need everybody to wrap their heads around this concept of Roe versus Wade no longer being the law of the land. It's hard to hear, it's hard to fathom, but it could happen. Second option would be they chip away at the law to the point where it's no longer valid or accessible, where abortion is legal in name only, right? Or there is this national 15-week abortion ban, which is problematic. And then the third option, this is like the guaranteed outcome likely, is that abortion will no longer be a nationwide issue, a federal issue. It will go back, the abortion rights will be decided at the state level in each individual state, which means you're creating a country where abortion is accessible in some states and not in others. Now, where the Texas law comes in is that this is another law that brings us a challenge to abortion rights in general. So the law in Texas is a 6-week abortion ban that allows the government has nothing to do with this ban, and only that they wrote the law. What you have in the Texas bill that is currently in effect in the state of Texas, what you have is that people who any person can accuse someone of helping somebody else get an abortion, right? That's a lot. That's very complicated, right? So I'll provide a hypothetical example. A nosy neighbor who's anti-abortion assumes that their neighbor had an abortion and that their aunt drove them to the clinic to get the abortion. The nosy neighbor can then bring a lawsuit against the family member that drove the person to the abortion clinic to get the abortion, all right? The government's not involved. The patient doesn't get in trouble. The doctor does, right? So the doctor that provided the abortion would be at fault, and so would the person who assisted the patient in seeking the abortion. It's complicated on purpose. And the cruelty is on purpose, right? So this is anybody in Texas can call out anybody else, and there's a $10,000 reward if it's found that that random Texan helped someone get an abortion. $10,000. So you've created a system of like vigilantes in Texas, kind of trying to hunt down these people that help others get abortions. And so it's essentially made abortion illegal in the state of Texas. Why is that a problem? Well, Texas seems to be the, for lack of a better term, breeding ground for a lot of anti-abortion, a lot of anti-social justice legislation in general, right? They're also leading the charge on voter suppression, among many other things. So what you see is that other states have already vowed to pass the same law. The Dakotas, Nebraska, some southern states have already said, we will bring this up in our state legislature. We haven't seen that expressly stated in in Iowa. But this is also relevant to the previous court case because no one's really sure how this will play out in the courts, right? It needs to be tested in the courts before we really understand, like, is Roe versus Wade applicable? How do we stop this? We've abortion rights advocates have tried every legal path that they can up to this point. So that was a lot.
Yeah, because it is a lot. And I am grateful for your knowledge and helping us to understand it all. So that brings us to Iowa. And we've had our own share of horrific bills that impact women and people and the LGBTQ community, and just bills that are basic reproductive health care, bills that are contraceptive care, bills that are abortion access. And we've seen that time and time again over the last several years. So talk with us a little bit about what we're currently seeing. And we're going to talk about the constitutional amendment also, but let's set that one also aside. But some of the things that we have seen over the last couple of sessions and the impact on reproductive freedoms for Iowans.
I'll start kind of where we are in this moment, right? And we are facing a new era in reproductive health care and in abortion rights in general, both in Iowa and across the country. A new era because the things that we've been the most afraid of are happening. Those like worst case scenarios are coming true. And we have always felt like there was a branch of government that could come in and stop it. That's just not true anymore. And what we're seeing in Iowa is we're moving towards an era of forced pregnancy. And I'll work backwards from there, right? So I say forced pregnancy because first and foremost, Iowans, while birth control is easily accessible in name, practically it isn't. So the state family planning infrastructure was essentially decimated. Planned Parenthood was defunded, removed from the largest, free birth control program in Iowa. And not a coincidence at all, but Planned Parenthood was the main provider of this state program. It is what allowed most people to just walk in the doors at Planned Parenthood, get their annual screening, get their cancer screenings, their STI checks, and then walk out the door with free birth control. That doesn't exist at Planned Parenthood anymore. About 15,000 patients across the state had to go find another place to seek that care. Now, can you go to any family physician, GP, and get that? Sure. It's just that people don't always want to, right? People want to go to Planned Parenthood, or people want to go to a gynecologist because they're experts in that type of healthcare. And so what we've seen with that at the state level and on the national level, there was another a program called Title X. It was another free birth control program. The Trump administration removed Planned Parenthood from that program. And so it's hard to just walk into a Planned Parenthood and walk out with free birth control. It is still possible, right? Planned Parenthood stores remain open. We remain low to no cost. And so folks still need healthcare at Planned Parenthood, come to us. We take insurance. And if you can't afford to pay, we'll talk about ways to help you pay. But what happened is as a result of that, other birth control infrastructures were kind of broken down, right? And so it's very difficult to access the birth control that an individual prefers or needs. Just in general, birth control isn't super complicated, but there are a lot of options, and there's not a one size fits all thing. So birth control access has largely been, or has been declining in the state since Planned Parenthood was defunded in 2017. 4 health centers closed, and again, there was this ripple effect.
Well, and it's ironic also, if I can just
jump in
more, the abortion rate in Iowa was on the decline. Right? We have data that shows that, and there was a tremendous amount of work. Former Lieutenant Governor Sally Peterson was part of that work, and the rate of abortion, unwanted pregnancies, really, is more descriptive. Was on the decline.
Yeah. So the abortion rate, the teen pregnancy rate, and the unintended pregnancy rate were all declining.
Yeah.
And now that these safety net programs for reproductive health care, now that these have gone away, we're starting to see abortion rates, unintended pregnancy rates increase. And so defunding Planned Parenthood doesn't stop pregnancies and abortions from happening, is what we've learned. And so you also see now there are attacks on sex education, right? So in Iowa, there are a couple public funding streams that Planned Parenthood can't participate in anymore. But then you're also seeing, not to go too deep into maternal health care, but we're also seeing that labor and delivery units across the state are closing at an alarming rate. It's expensive to operate a labor and delivery unit, especially if you live in a community where a lot of babies aren't born every year. It is also difficult because half of the babies born in Iowa are on Medicaid. Right. So Iowa's state funded insurance program the federal insurance program. And so the interesting thing about Medicaid when it comes to reproductive care, whether you're having a baby or getting a pap smear, it doesn't pay the provider, the doctor, the clinic, the hospital, it doesn't pay them for the cost of providing that care. It doesn't pay them the full amount. It doesn't, the reimbursement or the payment to the provider doesn't cover the cost of care.
Right.
And that's primarily only in reproductive health care. So you see reimbursement rates are low. So it costs a hospital money every time someone delivers a baby on Medicaid. So that's expensive. And when you're not doing that very often, right, we have a healthcare system in which hospitals need to make money to survive. They have to kind of have a corporate mindset because that's the reality of our healthcare system. And trust me, we're all doing everything we can to change it, but it takes time. And so labor and delivery units are closing across the state and along with rural hospitals. And so not only not only can you not really get the birth control you want or need, but you also might not have a safe space or a close place to deliver your baby, which is terrifying. So we're forcing Iowans into this forced pregnancy scenario because then you can't access birth control. You can't access, we see the decimation of other safety net programs like, food assistance, just basic education, childcare, and the like. There's no state paid family leave for Iowa. And then we could have an Iowa in a few years where abortion is no longer legal.
Yeah, and that takes us to the constitutional amendment. And there certainly are other pieces of legislation that we've seen over the last years, but let's focus on the constitutional amendment for a bit, because that is what is on the horizon. So Iowa has a constitutional amendment process where you have to the legislature has to approve the same language in 2 different general assemblies, an election between. They have the legislature, I will say this out loud, Republicans in the legislature have approved the first go round of that. And so we will could see it again in after the 2022 election, and then it goes to the people for a vote if it passes twice there. So talk to us about the constitutional amendment that we have specifically in Iowa before us, and what it would mean to reproductive care, abortion care in our state.
So what this proposed constitutional amendment does is that it says it will write into the Iowa Constitution. It's like, get a pen and let's write some new words in the Constitution. It will say that the Iowa Constitution does not provide a right to abortion or the public funding of abortion. So then what we will have in the Iowa Constitution is that the state legislature will be able to pass any law they want that restricts abortion. And then it also prevents that same Medicaid program I was just talking about. It prevents Iowans from using their Medicaid or Medicare dollars for abortion. So clearly you can see how that's a problem. How we got to this point was in the number of bills that have been anti-abortion bills that have been passed in the state legislature over a few years. There was a 72-hour forced waiting period, meaning before a patient had an abortion, they had to come see a doctor, wait 3 days, and then receive their abortion care. This isn't medically necessary. There's no medical reason why this needs to happen. It's just a deterrent, right? It's trying to prevent people from getting abortions. And so that case went all the way to the Iowa Supreme. There was a lawsuit. That case went all the way to the Iowa Supreme Court. In their assessment of that case, the Supreme Court found that the Iowa Constitution, right, through interpretations of various clauses, allows for a right to abortion, right? It's rooted in bodily autonomy, which means that Iowans have the right to make healthcare decisions about their personal lives. And abortion isn't something that impacts other Iowans, right? And so it's a very private and personal decision. And so the Iowa Supreme Court said Iowa has a right to abortion, and actually the state legislature, it can't do anything about it, right? They can regulate abortion, right? If there's a need for a regulation, they're welcome to regulate it. But they can't restrict it, right? There's a difference between regulating to keep people safe and restricting just to prevent someone from doing something. And so the Supreme Court said Iowa has a right to abortion, right? We have interpreted this Constitution to provide a right to abortion, and the state legislature can't pass any laws that restrict abortion. That's called strict scrutiny, meaning the court has to use the strictest interpretation of the law when applying that to the legislature. And so this constitutional amendment is an attempt to overturn that. It's an attempt to say, we are going to, it's like if you held the court case in your hands and you balled it up and threw it in the trash can, and they're like, we're going to write some words in the Constitution to prevent them from doing this. So that's the simple version. After that, 10-minute explanation.
It just kind of is amazing to me because we've heard all kinds of language from legislators that it didn't have anything to do with the court case, that it didn't have anything to do with what the Supreme Court did, and all kinds of turns and jigs to get around that so that they can make their arguments that it's just this pure constitutional amendment, and it's not to go up against what the Supreme Court decision said. So it's kind of telling to me that it really really does have to do with that, and that they simply just want, as you say, I like your thing, just get a pen and write some words.
Yeah. And I mean, look, what happens if you look at the state legislature's track record, if you look at the recent things that Governor Reynolds and, there are 60 state legislatures that signed on to an amicus brief supporting the overturn of this 72-hour waiting period case. The clear intent of this constitutional amendment is to ban abortion in Iowa. There's no way around it. And if it's not banning abortion, it's they'll say it's a 6-week abortion ban, which, mind you, is a ban on abortion, right? 6 weeks is 2 weeks after a missed period. If you know exactly, if your body functions on a very perfect calendar period schedule, which is not,
it doesn't happen for most people.
No. Yeah. Right. And so essentially, it might, it will be a ban on abortion, right? Constitutional amendment equals ban on abortion. There's really no other way around it. And our lawmakers, anti-abortion lawmakers, have made that abundantly clear, particularly as of late.
So I want to go to a question, Jamie. Jane had a question in the comments. Jane Robinette, that you know and we all love as an advocate. And Jane is asking, are you hearing anything about Iowa's special legislative session in terms of possible abortion policy in addition to redistricting work? So we know we have a special legislative session coming up. They're going to gavel in October 5th, is the plan. And it's supposed to be all about redistricting, but we know that they can really bring anything up that they want to bring up. Anything related to the Constitution Amendment's already been passed once, so we're not going to do that again. But anything else that you're hearing in terms of reproductive health care, abortion, et cetera, particularly following the Texas case?
I think it was Leader Confirst who said on Twitter a few days ago, if you think you know what's going to happen in this special session coming up, then you have bad information.
Yeah.
Right. We have no way of predicting how this is going to go. I get the sense that there will be something. My gut, pure gut, tells me that it will be related to, it'll be an anti-LGBTQ, probably an anti-trans legislation, because that is something that lawmakers didn't get to check off their list in the regularly scheduled legislative session. Now, abortion is a hot topic again. And I'm not ruling out seeing something in this special session. I would not be surprised in the slightest if something came up. I don't know anything for sure at all whatsoever. So here's what I say to advocates. Go take a nap and get some rest, because this special session we're going to be, something will come up. We'll need to advocate. We'll need to fight like hell on something. And it even if it's to keep the process fair, even if it's to keep the redistricting process politics free and fair, because we have the gold standard in redistricting, get ready. Yeah. Rest this weekend, because something's coming, but we don't know what.
And just to be clear, even in regular session, we don't always know what's going to come up when. So definitely not in a special session. So we will be ready, and we encourage advocates to be ready. One of the great joys in this work of ours is that we get to work in coalition a lot on a spectrum of issues, as we mentioned earlier. And not only with Planned Parenthood, but One Iowa, ACLU, domestic violence folks, just a whole spectrum. And I know I'm leaving people out, but on this, those are some of the primary groups on this particular issue. And why, in your estimation, why is it important for coalitions, organizations to work in coalition? And then what's the place of advocates in there? If somebody is passionate about these issues, is it good for them to just go start a group? Or is there a better way to go about that?
Yeah. So coalitions are important because none of us can do this work alone, right? Whether we're individuals trying to fight for something or whether we're organizations, there's too much work and it's too hard to do it all by ourselves. And it's silly to try to do it all by ourselves. We shouldn't, right? We live in a world where, I mean, we opened with this concept, this intersectionality, this intersection of all of these issues. None of these issues exist in a vacuum. And so you know, sometimes you'll see like, why is Planned Parenthood involved in gun safety or workers' rights or the labor movement? It's because none of these things exist all by themselves. We are all impacted by them. So coalitions are important because together we're stronger, plain and simple, right? It can take, you know, bringing more people to the table takes more time. It can move a little slower than we'd like to move sometimes, most times, all the time. But our collective ideas and our collective resources, right? Not just money, but brain power, time, whatever it may be, bringing all of those things together is just much more powerful. And you're dividing up the work. So that's why coalitions are important. If, you know, you get an idea in the middle of the night and you're like, I'm going to start a thing to fight a thing, right? If you want to really stand up and fight for something, chances are there's already a coalition out there working on it, right? And coalitions are great, again, because there's lots of people, there's lots of brain power, we pool our money together. Our money is stronger together. And of course, all of this, we have to follow legal guidelines, right? Don't, nonprofits interacting only with nonprofits and political organizations only interacting with political organizations. But it's important to kind of like just do a little research, right? Because chances are you can join, like, you don't have to do it all by yourself. You can join a coalition or you can join an organization that already exists. And if you like, even if you're like, but I don't like those people, I don't want to work with them, give it a try. Right? I'll tell you, in coalitions, we don't get along all the time. We disagree. There are different things that, you know, we want to do, but we learn and grow from one another. Right. And so that's why it's important. You know, I never want to tell an advocate that they shouldn't go out and do something, but chances are, like, you don't have to like start a whole new organization. Probably already exists, and they will probably really, really need your help.
They probably really do. Yeah. And they may be able to find your own kind of niche in that organization as well. And not to stop anybody from starting their own organization, but I agree. Like, look around, see what's already there. You may want to work with those people in your way that fulfills what you're trying to achieve. Jamie, how kind of in closing, how can folks help? How can folks get involved with the work of Planned Parenthood in Iowa?
Yeah. Well, I would say if you're involved with the Interfaith Alliance, keep it up. And if someone from Planned Parenthood, whether it's an email or a text message or a Facebook, something that you see, if Planned Parenthood is asking you, and we are asking you, right, we're asking you to reaffirm your support for this fight. We are building our capacity. Well, we have been building our capacity across the state, right? We know where Planned Parenthood supporters are. We are educating them, activating them, motivating them for the incredibly difficult work that's ahead. For those of you in, Eastern Iowa, the Cedar Rapids, Iowa City corridor, or here in Central Iowa, it's a little easier to get involved with Planned Parenthood. But reaffirm that support, sign up again, right? We're asking people to recommit to the fight. We really need to know who's with us and who wants to do something. We're in an era where it's not about a name on a list. It's we need you to click the button and type the message to the lawmaker. We need you to show up in the online spaces and voice your support or your opinion. We need you to take the action that we're asking you to take. And of course, we're still living in a pandemic. And so all of our actions will continue to be safe and socially distanced, likely still virtual for the foreseeable future. But now is the time to take the action. There is no later. We are in the moment now. So you might be seeing these things come through, right? Whether it's an email from me or someone else from Planned Parenthood, but join the fight. We really need you to take the action, to show up to the workshop, to, we're trying to make all of our activities engaging and different, and no two will be the same.
Thank you, Jamie Burch Elliott. I am grateful for your time today and for your expertise and for helping us to understand the lay of the land, not only in Iowa, but across the nation. Grateful for all of the work that you do and that Planned Parenthood does on behalf of reproductive rights, reproductive freedoms for all Iowans. Just truly appreciate it, and always appreciate working in collaboration with you and with the organization. For folks who are watching, thank you for being with us and for watching what's happening today. If you are new to Interfaith Alliance of Iowa, you can sign up for our email, and you can find that at our website, interfaithallianceiowa.org. You can find us on social media, of course, on Facebook and YouTube, but also on Instagram and Twitter. Thank you again, Jamie. I appreciate you, and I appreciate everyone who is listening in. I started a tradition this year of ending what's happening by reminding people to register to vote. And if you are already registered to vote, help somebody else to register to vote. It is critically important in our democracy and to protect our freedoms that we each vote in every election. But for now, please stay safe and take care and have a great week.